started to eat more steak and eat more cheese and eat more of all these taboo foods that certainly no one was talking about at that time. And things just started to change for me.
Healing is great, but at the same time, losing weight will help you heal too, right? As opposed to just heal, 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 and stuff all the butter. That's not going to help, right? Because fat is inflammatory and you need to develop that momentum. You need to feel like, as I'm healing, I can physically see the healing. I can physically see the inflammation dropping, losing the shedding the excess body fat. That's all healing as well. Hi, everybody. Thank you so much for joining us today. I am very excited to catch up on all things weight loss, hormones, gut health with Dani Conway. Dani, it's been a long time. I'm so excited that we get to catch up today. How are you?
I'm great. I'm great. How are you? Thank you so much for having me. I know it's been a while, but I'm excited to chat about all the things that we both love.
I know, I know. So before we dive in, can you give our audience, if somebody is watching this for the first time, a brief little overview about your health journey, and then we'll dive right in.
Yeah, absolutely. So, years ago, I was 65 pounds overweight on a fat-free diet. I was in my 20s. I had tons of hormone and gut issues. I did hours of cardio every day, and I was still at the heaviest weight that I've ever been. So that was about 65 to 70 pounds heavier than I am now. That really just set me on a path looking for something different because I had lots of experience with chronic yo-yo dieting, restricting calories, doing, counting all the things, points, and all of that and still not really getting anywhere. I had tons of food cravings, not necessarily sugar cravings. I know you work a lot with sugar cravings, but food cravings for me, it was like just I just wanted to eat large quantities of food.
Mhm.
And that just set me on a path looking for something different. The traditional diet stuff didn't work. My doctor said, "Oh, your blood work is normal," yet I still felt like crap. So again, just set me on a path looking for something different. And this was back in 2007. So people think that, lower carb, keto, carnivore is less than mainstream now. It was really less than mainstream back then. So, I just kind of I always craved fatty foods and I just, started to eat more steak and eat more cheese and eat more of all these taboo foods that certainly no one was talking about at that time. And things just started to change for me. So diet wise, food first always. That's how I approach, my own practice and clients. And then kind of building on that, I got into functional medicine. I was able to really get to the bottom of a lot of my own hormone and gut issues. And really at that point felt like I couldn't have been the only woman struggling with no answers, trying all the traditional things, feeling like nothing was working. And so that's how I got into practice, got my certifications, got into doing, more functional testing, really looking for root cause. So, we talk about root cause healing, and that is absolutely what's needed. But I really look at it as rebalancing the body from the inside out. So, we hear a lot about, oh, the body has to heal first before we lose weight. And I completely agree with that because weight loss does happen as a byproduct of the body being healthy and in balance. But at that time, I did not resonate with healing. I didn't feel like I was sick. Right. So I really, and I encourage this for my clients as well as looking at it as rebalancing the body from the inside out. So if everything's right on the inside, everything can be right on the outside. So that's a little snippet for you.
Love it, love it. Yeah. And yeah, I agree. The healing is really important, especially the gut healing, is especially if you're dealing with cravings or you're dealing with low energy or depression, anxiety. A lot of times it's difficult to stick to any meal plan if you are just struggling to get out of bed every morning, And so fixing the gut is very helpful. But yeah, I always say it's like healing is great, but at the same time, losing weight will help you heal too, right? As opposed to just heal, heal, heal and stuff all the butter. That's not going to help, right? Because fat is inflammatory and you need to develop that momentum. You need to feel like, as I'm healing, I can physically see the healing. I can physically see the inflammation dropping, losing the shedding the excess body fat. That's all healing as well. So yeah, I agree.
Yeah, and I love how you said that. And also I would have just added like so I love that you said that. And what I would just add is that there are a lot of women that I talk to that are actually almost ashamed of the fact, or they don't even want to talk about their weight loss and fat loss goals because there's so much in the space about heal first, heal first. And
Mhm.
so it's almost like they've been shamed to feel like, they shouldn't have weight loss and fat loss goals. So I like to kind of address both. We want to make sure that we are rebalancing from the inside out. And if we have to do reverse diet or, making sure their macros are correct and all of that, that's all part of the process. So if I can help them rebalance all the things while, having them feel confident that they want these weight loss and fat loss goals, I think that's even better. That empowers them even more.
1000%. It is so difficult to battle cravings while you're putting on weight. I've had people come to me after trying different protocols where it's recommended that they just, not count calories or, all that kind of stuff. It's so common. And almost everybody kind of gravitates towards that because, of course, everybody wants to try the easy way out first and see
Right.
if that, right? I get it. Uh, but I don't think people realize what it actually takes to peel off 1 pound of fat, how easily you can put on a pound, and how much work it takes to take that 1 pound off. If people knew it, it's like criminal to even put their bodies through that. It really is. So that's why I try as much as possible to tell people how critically important the weight loss aspect is because
Right.
fat doesn't just store excess calories. It's an endocrine organ that's secreting estrogen. So now you have estrogen dominance. You're increasing your risk of hormonal imbalances. Now PMS comes, you already are in an estrogen dominant state, and it's just catastrophic whichever way you look at it. And you cannot hack the solution, right? Like there are things we need to study and learn for a long period of time to understand how to deal with this and
Mhm.
help people deal with their health issues and the cravings and the weight loss all at the same time. There's a whole body of literature on how we deal with food addiction. It's not just replacing your addiction with sticks of butter. That does not cure addiction. You know what I mean?
Yeah, and if I could comment too, so the estrogen dominance thing is like it's a really interesting, I'm going to say, let's just call it a concept because we know it's been around for a long time. And we all know what that means. But I think that as far as having more estrogen than we want to have, but
Hmm.
what I don't think a lot of women realize is that estrogen dominance is a byproduct of metabolic inflammation. So if we can get rid of the inflammation and we can do other things to balance hormones without having to just solely focus on lowering estrogen, because we actually don't want low estrogen, because estrogen has a lot of benefits. And everyone out there is talking about, be careful. No, no, no. We need estrogen for brain health, for bone health, for libido, for body composition. Like estrogen still has a role with body composition too. So all that to say, estrogen dominance is, if you focus on the metabolic inflammation, and that might mean both, we've been talking a little bit about weight loss and fat loss, but just to kind of say weight loss and fat loss can be two different things. And you might need both. I needed both years ago. I needed to lose weight and I needed to drop fat. So looking at each of these, there's so many sort of terms that are thrown around out there, and we think we know what they mean and we get the drift, but when we really kind of drill down, again, it's estrogen dominance, especially because it's like such an abused term. Definitely, definitely metabolic inflammation is what you should think of, or your viewers, especially all the women out there when we talk about estrogen dominance.
Yep, yep. Okay. So, let's talk about actually, let's start with the hormones since we're talking about that, and
Yeah.
then we'll talk about the
Okay.
insulin part, right? So, we were talking before we started recording on how you found this shift lately, whereby instead of targeting hormones first, you realize that if we heal the gut first, the hormones tend to normalize by themselves. So, can we talk a little bit more about that and what are the tools that you are finding the most success with?
Yeah, so I think let me just give a little bit of background if I can. So years ago, when I started my functional medicine training, this was 2008. I was trained to work on the hormones first, work on the gut second, and work on the detox system third. So functional medicine, we view the body as, different body systems. We're looking for root cause. We want to heal the root cause, and then things will rebalance. So along the, years kind of passed on and, I would kind of experiment with different things. And more so, I would say, like we were talking in the last, I would say 4 to 5 years, I've really kind of noticed that if I start to work with clients on opening up their detox pathways, opening up their drainage pathways, and then working on their gut, and we actually retest hormones before we technically get to the phase where I'll air quote, work on hormones. I see tons of improvement in their hormones just from working on the gut and detox systems. So
Mhm.
that just goes to show you like how those systems are so interconnected and that fixing hormones, like the root cause of a hormone problem isn't always a hormone problem. And I think that there's, just not that there aren't, hormone changes and stages of life and, premenopause, perimenopause, postmenopause, all the stages. However, there are ways to work on the hormones without even technically working on the hormones that actually help to rebalance the hormones.
I love that. Yeah. How many people come to you who have candida overgrowth, who have SIBO, who have some form of gut infection? They've had it for a long time. Sometimes people live with that for so long that they normalize it. They don't realize how critically important it is to eradicate it, right? And then they start layering health condition after another as they get older because the hormonal imbalances that are due to those gut issues just start to lead to all kinds of symptoms, skin issues, inability to lose weight, cravings for sugar, whatever.
Yeah, the skin health piece is so interesting because with skin we have the eczema, the psoriasis, the rashes, the acne, mouth breakouts, all these things that are happening, skin health, gut health. Like there is a, direct connection with gut issues and skin issues.
Mhm.
And then we take the liver detox and detox pathways into consideration where the body is going to push toxins out of the skin if it's the other pathways are backed up. Especially like one of my biggest peeves is, oh, it's okay if you only poop once a week on carnivore. I'm like, no, if you only poop once a week on carnivore, like we have to get your drainage pathways working. We have to get things moving so that you don't recirculate toxins, so that you don't recirculate estrogens. I mean, back to the estrogen for a second. Well, I'm on a little tangent here, but I'll just go with it. Is the estrogen metabolism and phase three of estrogen metabolism happens in the gut and with the stool. And if it's not working properly, for lack of a better term, someone is going to recirculate all those toxins that your body's trying to eliminate through that daily estrogen metabolism back into their system.
So, so well put. I agree. That's why I will recommend also supplements and things to get things moving. Because
Yeah.
sometimes people have to do carnivore for a period of time, but once they do it, they do go through a period of constipation until we fix gut motility, the vagus nerve to work, until we eradicate SIBO, eradicate candida, all that kind of stuff. So there is a period of time where we have to introduce some artificial things to keep things moving, like exactly like you said. I'm wondering, how would you approach, let's say, a client like that? What would you, or just in general, would you start with a diet first or the supplements, or like do you compromise on the diet? How does that work?
Yeah, so I have always approached everything as nutrition is the foundation for everything that we do. If food isn't right, nothing can be right. So that's where, like, the name of my practice, Nutrition the Natural Way, that's exactly where that came from. So I don't want to start working on like my approach with functional testing. Test, don't guess. Test so we know exactly what's going on. We know what supplements someone might need. We know what, macro or dietary changes they might do best with all of those things. But still, if the foundation isn't right, nothing else can be right. We can't build on health or build on that foundation if the food isn't right first. So I do start with, aligning their macros, whether I do, I work with clients on a spectrum of low carb through carnivore. I think that unpopular opinion, not everyone in this world has to go strict carnivore in order to, rebalance their bodies. So I would rather if someone does not have to eliminate all plants because of whatever they have going on, I would rather them work with them on something that is sustainable for the long term and that they're going to get results with so they can stick to rather than them feel like they're completely deprived or that, oh, I'm doing this carnivore thing, but this isn't going to work for me long term, you know. So everything has context and nuance, and once we build that foundation, whatever that is, and I have plenty of clients that are also strict carnivores. So again, like I'm not a one size fits all kind of gal. I think
Yeah.
you're the same way, like
Same.
everyone's in
Yeah.
biochemical individuality.
Yeah.
And so then from there, then we look at, functional testing, blood work, urine testing, stool testing, see exactly what's going on.
Yeah.
Then from there, we integrate, supplements that they might need for a period of time as like a therapeutic protocol. So I say that specifically because it's not something that they should be taking forever. It should be taken for a period of time with a goal in mind and an end in sight. And I say that because how many people come to you with lists of things they're taking and they have no clue, like, oh, this doctor gave me all these things. Why are you taking them? I don't know. Did they do any testing before? They did this one test, but they didn't really tell me what these things meant. I was like it makes my head want to literally explode.
Yeah.
So that's kind of, very strategic as far as working with each client, biochemical individuality, and then kind of building on the foundation and building on what they're ready for. Supplements, I do use some peptides in my practice, but all those things are extras. If
Yeah.
someone is not doing the foundational work first, the food, the movement, the sleep,
Yeah.
even drainage stuff, self-drainage stuff, walking, sunlight, grounding, all the things,
Yeah.
I'm not going to go put them on a supplement protocol and
Yeah.
everything, caveat is, of course, if they're struggling, they might need those things. But the point is that, yes, for the most part, 80% they're working on them, and then we give them the assistance they need based on whatever their testing tells me.
Yep, yeah. And thank you for mentioning movement. I feel sometimes like I'm the only voice that's talking about exercise, exercise, and everybody. I mean, you have health experts that are actively discouraging exercise, not just within the carnivore community, but even in the food addiction world, because I'm kind of like in the intersection of both.
Yes, right.
And I see it everywhere, and it's like blows my mind. I feel like that is the foundation of life. That is the foundation of everything.
Yeah.
How do you expect to heal your brain, to heal your body if you're not moving a body that was designed to move?
Oh, thank you.
Right?
Yes.
I hope you're enjoying this podcast. This is a reminder that I will start the group coaching on May 1st. Every month is going to be the beginning of a new cohort. So make sure that you sign up if you want to catch this group coaching month from the beginning. The current schedule is every Thursday at 2 p.m. Eastern and every Sunday at 11 a.m. Eastern. I will be leading all of the sessions and I will answer all of your questions and also provide support. And we'll talk about all things about how to optimize your diet. You don't necessarily have to be carnivore, but if you are carnivore, that's also fantastic. We can talk about how to optimize your meal plans. We can talk about all things gut health, raising baseline dopamine, and all the things that I talk about on this channel. So if the kind of work that I do resonates with you, I think this is a great way to get the support and the accountability and to stay connected to this world so that you don't let your guard down with the food so that everything else improves along with your health and well-being. The link to sign up is at drzaldivar.com/group coaching. Also remember that I will send you a free copy of my guide, the 30-day carnivore diet challenge guide, when you sign up to my newsletter at drzaldivar.com/newsletter. All right, now back to the podcast.
And then, like, if we look at your lymphatic system and, your drainage pathways, which
Yeah.
they're connected, like you said, brain function. I think maybe this is a good segue, but I'm just going to say, like, the most under-discussed tool to go from insulin resistant to insulin sensitive is resistance training, right? Because of how
Thank
our
you.
muscles use glucose in our body. So it's wild.
It truly is. I mean, so I did my bachelor's and my master's in dietetics, right? And
Right.
then a lot of my classmates, they just, if they wanted to pursue a PhD, they did a PhD in nutrition. But I remember I was like, I looked up at the programs, PhD in nutrition. It's the exact same course you already took in the master's. It just, there's no way I could sit through the same information. I could die. So I chose, and I'm so glad. That was really such a fantastic is if anybody is following in that route, I highly recommend always complementing those two aspects and choosing the exercise component. And I ended up doing my PhD in exercise physiology. And so there's once you have those backgrounds or you're just educated on them, you will see that we cannot have one without the other.
Yeah.
You will never achieve true health, true freedom from food focus, true everything, longevity
Oh,
with, right? They
it's
have to, right? They have to be together.
Yeah, and so I think like if we can just chat for a second on like resistance training versus cardio, because I know you love to run. And I mentioned resistance training that I went from doing like hours of cardio to resistance training.
Mhm.
And I think it gets a little jaded because when I talk so much about resistance training, it doesn't mean I'm not doing any cardio. We have to realize that each type of exercise has a benefit. So you talked about longevity. Obviously, cardio is going to be important for heart health, for longevity. However, if we have a client who is stressed to the bone, not sleeping, cortisol is completely messed up,
Yeah,
you better believe that the first thing I'm not going to tell, I'm going to tell them to do is not to do cardio, right? So they have to do some restorative type things.
right.
So I feel like when people hear things, it's always like, oh, she said no cardio. No, nuance and
Yeah,
context, right? Maybe for one person, but
yeah,
not for the next person. The resistance training, obviously, tons of benefits, bone density, muscle mass, body recomposition, hormone, brain function, all the things.
yeah,
Again, super stressed individual, maybe they don't need to lift super heavy. They need to do something more restorative, Pilates, things like that. But that doesn't mean, they shouldn't lift or they shouldn't lift heavier, they shouldn't challenge themselves. So all of that to say, like there's a lot of, little different nuances that come into exercise movement and
yeah.
what's right for someone on an individual basis.
And exactly, this is where your experience, your education, and doing this from a scientific background with all the experience you have, this is why people have to hire coaches that have those credentials, right? As opposed to just following an influencer who's like, I lost weight this way and now everybody should follow this, And that's the
I love
biggest,
you.
right?
I love you.
Because it's so easy to fall into that trap to think that if something worked for me, then that's the only way and it's going to work for everybody. But not everybody has the same genetics, not everybody has the same history with the food, not every, right? And so, yeah, I mean, I wish it were easier, obviously. I wish it was a one size fits all. But no, this is why the continuing our education, continuing working with clients experience every day, every month I make new revelations and I remember like older cases like, oh, that would have worked in that case better,
Yeah.
Yeah,
No,
and that's how it should be.
yeah, I can totally relate to that too. And, I think we both have a passion for continuing education. Like I will always be obsessed with learning more. I will always be, looking for the next best thing. And, I'm not interested in maintaining. Like to me, when I hear the word maintenance, I am like, get me as far away from that word as possible. I don't like to use that with my clients. I use that word sometimes because people know what that means.
Mhm.
However, if we're maintaining, we're not continuing to transform.
Yes.
And in my 20s, when I started this, I have, completely different things going on than now. Like I'm 48 now. So again, stages of life change, we learn different things. The tools that I have now are not the tools that I had available when I started my practice in 2007.
Yeah.
You know, I could like feel like a grandma when I say that. Like it seems like so many years ago.
That's the
But
youngest grandma I've ever seen. You look great.
thank you. But in any case, yeah, I think that, just overall, just the continuing of learning and experience and like knowing that clinically, and actually, I just talked about this in my stories the other day because two clients, and this happens a lot, two clients, very similar complaints. We run up, a hormone panel. One of them has super high cortisol, one of them has super low cortisol. guess what? Everyone out there is talking about what to do if you have high cortisol, because if you have high cortisol or if you have belly fat, you must have high cortisol.
Mm,
Well, if we were to give these two women this same exact protocol, one would make one better and the other, that protocol would make the other one worse. So again, test, don't guess, really figure out what's going on. To a certain degree here and there, of course, we can go based on symptoms, but if someone's really looking for that next level, those long-term results, we need more data than just symptoms.
what are the most common tests that you find you run in your practice?
So comprehensive blood work for sure.
Mm,
I run about 90 to 100 markers on between blood work and urinalysis.
mhm.
So that is really at the top of the list because most clients, I mean, I think in the last almost 20 years, I've had maybe 5 clients who have been able to get their doctors to run everything as far as everything I want to see on a blood panel,
Right.
which I'm sure that doesn't surprise you.
Yeah.
And then from there, I do, urine testing as well for hormones, stool testing. I like to do all the bodily fluids. I like to say, like the bodily fluids don't lie. I think that, some clients come to me and say, oh, speaking of long list of supplements, oh, this practitioner muscle tested me and said that this one was going to be good. And I think muscle testing has its benefits here and there. And there's, great muscle testers out there, and there's some that, aren't so great.
Yeah.
But for me, and it's how I was trained, nothing speaks louder than blood, stool, and urine
Mm,
from your own body to see exactly what's happening.
yeah.
So those are my preferences for testing. And of course, test, don't guess what's going on.
Love that. And what about heavy metals and things like that?
So I do mycotoxin, environmental toxins, and metal testing through urine. So I
Mm,
know, a lot of some clients or some practitioners use hair testing.
right.
So I'll be completely transparent. I will not ask my clients to do anything that I'm not willing to do. And I am not willing to cut my hair for a lab test. Therefore, I do not ask my clients to cut their hair for a lab test. Many of them are struggling with hair loss. So the to get them to even think about cutting their hair, like my job is to relieve their stress and not add more stress to what they're going to be doing.
Right.
That's why I prefer urine testing for, again, all I say like all the toxins, environmental, mycotoxins, and heavy metals.
Have you ever done or ha do you specifically go towards specific, let's say, types of urine testing, like the provoked, the DMSA? I did it once a long time ago. I never did the chelation though, but I want to do that just to make sure all my markers are good. But I do
Right.
remember doing the chelation, the provoked, not the chelation, the provoked urine test for heavy metals. So you take a DMSA pill and then you collect urine. And so the DMSA pill pulls all the heavy metals out into the urine, right? So what are your thoughts on that?
So I think that's definitely valuable. So I will do it a little differently with clients. So some clients, I just have them take their testing and I don't even worry about any provocation.
Right.
And I mean, I can just think in the last, off the top of my head, 6 to 8 months, maybe 2 clients, we didn't get a super what I didn't think was a super accurate test just by doing the testing alone.
Okay.
Now, that being said, sometimes I'll have them um, take their liver support, glutathione, binders for a week or two prior to their collection, stop all that for 2 to 3 days, and then collect. So I like to do, that's the kind of provocation that I do is just a little bit of liver support, some glutathione and binders, kind of get things moving a little bit, have them do things like castor oil pack, uh, dry brushing, vibration plate, the self-lymphatic stuff that also can kind of get things moving. And I find that that's enough in terms of, the results that we are looking for.
How how much of an effect do you feel targeting the detox of those heavy metals and the toxins? How like compared to other changes with I'm sure the diet is very powerful as well, obviously, and the
Mhm.
exercise. But have you ever been surprised at how much the environmental toxin exposure is affecting people's results?
So It's an interesting question because it doesn't surprise me, but a lot of my clients are clients who have been carnivore for anywhere from 6 months to 2 to 3 years,
Yeah.
and they're still struggling. So when I put them on a protocol and
Mm.
they start seeing results and getting results and all these changes start happening. And yeah, we fine tune their carnivore a little bit because maybe they've had the what I call the carnivore creep, where it's just kind of a like they've been carnivore so long they get a little bit bored because they're not getting the results they want. So they're still eating carnivore, but carnivore foods that they shouldn't be eating all the time kind of creep back in more than they should.
Like what?
Dairy,
Uh-huh.
like dairy foods and maybe a little bit more processed foods, and maybe they're getting a little bit lazy with their carnivore in the sense that like they're grazing more on carnivore foods, more pork rinds, things like that, and they just don't realize it. But it's just again a byproduct of a little bit of boredom and a little bit of like I'm not getting results anyway, so I'm just gonna I'll just have these pork rinds or I'll just have this or I'll just have that. It's still carnivore, so they're
Right.
still technically carnivore. um but the surprise is more about like once we do the protocols and they're, still carnivore, and then they start having these shifts happen in terms of, um, again, whether it's weight, whether it's energy. I just actually had that happen with a client yesterday. Energy improved. She dropped like 3 or 4 pounds, which doesn't sound like a lot. First of all, she's small to begin with.
Mm.
Second of all, she's been stalled for months, right? And all we did was implement the detox, the protocols that we're talking about that were just tailored based on what she has going on. So it is a lot of, combining the right things to get the best results.
I'm wondering if the candida clearance, first of all, how common do you find candida to be? And also, um, do you ascribe to this hypothesis in the functional medicine world that candida never really goes away unless you're doing strict carnivore? But let's say you're not strict carnivore and you're tried all the candida diets to try to take it out, but it doesn't really go away until you eliminate the mercury from the body.
So mercury is one thing. So if candida sticks around, I always say all these pathogens, they love each other. They like to live together and they like to harbor with each other. And they build what are called biofilms, and biofilms are these forts that keep them from you going after them. So in a protocol, we have to go after them with biofilm busters. But to answer your question, if there's heavy metals and or mycotoxins, someone could do all the candida diets and herbs that, from now till next Sunday, and it won't eliminate the problem. They have to go after the bigger heavy hitters in order to then clear the candida because the other guys are keeping the candida around.
What have your main treatment protocol for candida been? Like, what are the biggest things you're going after?
You mean like herbs or
Just
the
in general, let's say you have a client comes in and you realize, okay, well, candida seems to be the root cause because I see this so
Mhm.
much in people. And I can see like all of everything that they've gone through is because, oh yeah, I've been dealing with candida for decades. And it's like,
Mhm.
oh, well, then let's make sure we attack that. And then I have a pretty high degree of certainty that everything else that came after that should self-regulate, you know?
So usually it's in like what I find is hidden mycotoxins.
Mm.
So mold exposure and then mycotoxins are what, the body, the toxin that is produced in the body. And so there's obviously mycotoxin exposure. There's also SIRS. So just to be very clear, I'm not a SIRS practitioner. I refer out for SIRS specific cases, but
Mhm.
I do work with clients on eliminating and detoxing mycotoxins. So we do that testing, like I mentioned. But to answer your question specifically, it is the underlying mycotoxins and sometimes metals, but more so mycotoxins that will keep the other guys at the higher level around. They are usually like the root cause of
Gotcha.
why candida sticks around.
Right. So again, like we go back to how important it is to detoxify the body and get things moving. Yeah.
Right.
And not feed the candida ever again anymore, yeah.
Yeah, and I think like to your point a couple minute or two ago, with any pathogen, there can be levels that I'm not going to say healthy levels, but I guess healthy, you could say healthy levels like an inactive level where it might be there, but it's not actively doing any harm, so to speak. You
Yeah,
know, there's a
yeah,
couple pathogens where if they're at bay or there's a low level, then that's just part of the ecosystem. But it's when why does the person become the best host for that opportunistic bacteria to then take over and then the leaky gut and then, and then.
do you test for leaky gut?
So there are tests for leaky gut, but I look at what's going on based on the test that I had already mentioned.
Yeah, yeah,
And I kind of know at this point, like, I know when a client is struggling with leaky gut, when they have nutrient deficiencies, when, they've got bloating, constipation, anxiety, depression, brain fog. Leaky gut isn't something I kind of stopped doing a specific leaky gut test because I just kind of honestly I felt like it was a waste of money. I'd rather them spend their money on other testing where at this point in, like I said, almost 20 years, I pretty much know when a client has leaky gut,
yeah.
so that's still part of their protocol. But I'm big on correlating markers on an individual test together and correlating each of the tests together as far as looking for hidden problems. So one marker doesn't always tell the whole story, but one marker here, and one here might connect the dots to what they're feeling or what they have going on.
Perfect. Yep, yep. Um, so now that we've covered a little bit the hormonal and the gut health aspect, I see the same thing. I feel that once we heal the gut, almost everything is healed, pretty
So true.
much. That's it. Yeah.
Let me just mention, I love earlier you mentioned the vagus nerve
Mm.
and the brain, obviously the brain gut connection with that, because I feel like the nervous system regulation, vagus nerve, it's under discussed with how important it is, like how important of a piece of the puzzle that is.
I feel like it's everything, right? Because if your vagus nerve isn't working the right way, I don't care what diet you're following, if you don't have good gut motility, that's going to promote the proliferation of SIBO and other kinds of growths and microbiome imbalances. Because even protein can be food for bad bacteria. So even if you're doing carnivore diet, if you have a vagus nerve that's leading to slow gut motility, you're gonna run into issues down the line. So yeah, I agree. Yeah, I mean, it's so fascinating to me to talk about the microbiome and gut health, and it's kind of a little bit frustrating that it's more in the vegetarian and the plant-based world that they love it so much, and we try to ignore it within the low carb and the carnivore community. It's like we don't really know much about the microbiome, so let's move on because then it draws so many questions about fiber and all that kind of stuff. And I think I think if the carnivore scientists and experts and researchers double down on the microbiome, then you're unstoppable. If you understand how to do the carnivore diet, the power of it, and you understand the microbiome, there is nothing that cannot be cured, I feel, with these two. They are the basis of pretty much everything.
Yeah, and I totally agree with that. And I think another important piece of the puzzle here, and we didn't really touch on this yet, but like even with digestion, assimilation, absorption of nutrients, like one meal a day versus 3 meals a day. Like I'm not a fan of OMAD. I'm not sure about you, but I'll go first. I'm not a fan of one meal a day for many reasons, for women especially. I think 2 or 3 meals is ideal, and a lot of women don't start losing weight until they actually go back to 3 meals a day. But in the context of what we're talking about with the gut health, is that getting everything they need in one meal is very hard for their bodies to digest. So they already have gut issues, they already have leaky gut, they already have motility problems, and then they try to get everything in one sitting because, Carnivore Joe said OMAD is the best and they should eat 1,200 calories for weight loss, and they try to eat everything in one meal and they're like, but I am bloated and I have the constipation or diarrhea. It's usually one or the other.
Right.
And I have low energy. And again, this is not a solution for most women, especially over 40. Their hormones are changing. That's a majority of the women I work with,
Yeah.
midlife women over 40, their hormones are changing. Things are not working. They feel like things aren't working the way they used to be working, and all those things. So, anyways, that's just, I don't know if you kind of
Oh,
see that or how you feel about that.
totally. I think because we work out and we believe in movement, also that's another added reason why you need to be able to get all your nutrients in. So I'm not gonna have the same level of workouts that I plan to have. I cannot improve with my workouts over time and raise my baseline dopamine and improve my hormones and improve my energy and keep pushing myself. I can't do that on one meal a day, or worse, not even eating. Like
Right.
that's
Fasting.
insane,
Yeah.
right? Yeah. And then coming from a food addiction background, and I get very severe cases of food addiction. If we forget about everything else that I do, and if we just study the food addiction literature and the food addiction scientists and the way it's done just in the food addiction world, they really hate intermittent fasting. They really hate fasting. It's like anything that could potentially trigger somebody into a binge, they hate it. I'm not to that extreme. I think, because most of the food addiction world is recommending plant-based and it's recommending a normal diet that's bland, that's sober, but it's not really carnivore. The way that I do it, because of my knowledge with carnivore, and I do think it's easier to overcome addictions on carnivore as close as to carnivore as you can, then um, fasting isn't that much of a trigger, like a little bit of fasting, but at the same time, not having one meal a day. Like I would not really want to push anybody with a history of food addiction to eat one meal a day. That's an maybe they can do it, but after I have a high degree of confidence that they've really healed their brain to a level and they've healed their habits and they've healed their triggers and all the things that can increase relapse rates to like 95% in the first 90 days, really got to have a good handle on that before I even open up my mind to like, oh, so you really want to do OMAD? Let's see if we can do that, you know?
Yeah, so I love this topic because I have been ridiculed for saying and people thinking that I do not like fasting and I don't support fasting, and that's not actually the case. So, to kind of break it down a little bit, my approach to fasting is what I call fueling before fasting. And that means that someone needs to get what they should be eating and doing correct in their eating window and fueling their bodies before they extend their fasting window. And that also means that that focus on fueling correctly in that eating window might be 2 months, might be 3 months, might be 6 months, might be 8 months. I'm not talking about for a week they get their eating window right and then they just start fasting. And it's not until they get to the point where their bodies are ready that they then can implement some fasting, not extended, not OMAD, but some intermittent fasting. I do love intermittent fasting personally. I think it's a very, very valuable tool. And I think that we need to teach women how to do it correctly and how to not just think that they have to intermittent fast every single day. It has to be an exact strategy with the exact eating hour, excuse me, fasting hours. And, everything has to be rigid, rigid, rigid for 2, 3 months in a row, days at a time, in order to work. The body adapts, so we have to keep the body guessing. So some weeks, more intermittent fasting days, other weeks, less intermittent fasting days. This is super unpopular opinion. I think that some women do great at 12 hours, just what they need to rest their digestion. And then sometimes they can go to 14 or 15 or 16. Women can have very, very a lot of success with that. We'll call it a small fasting window and
Yeah.
prioritizing everything they need to do in their eating window with that, with those strategies, then worry about the extended fasting, the OMAD, then it goes into their binging restricting patterns kind of thing, which I'm sure that's what you see and that's what you were talking about. And so I just like to be super clear, like I love intermittent fasting. I think it's great for women. Nuance and context. When they're ready, when their bodies are ready, if they have a history of even chronic yo-yo dieting, not even, let's just not even call it, food addiction or eating disorder, just chronic yo-yo dieting, getting their body, improving their metabolism, getting their body to a place where it feels safe. They can eat more than they thought they can eat without gaining weight. All those things, and then implementing fasting, that is the best, most successful strategy to do, to have women learn how to listen to their body and then be able to implement fasting successfully.
I love everything you just said, 1000%. I think the worst thing we can do is try to push through a feeling of hunger and trying to force fast ourselves, you know? The vast majority of women come from the cycle of restrict binge, restrict binge. So now, what a powerful trigger to just go all in, you know? And even on carnivore foods, you could binge on that, and then you're
Oh,
not
I have
right.
I have women that come to me and they're like, I started binging on carnivore foods. I'm like, well, we need to get to the root cause. Like, if you're binging on carnivore foods, then there's something else going on. That could be physiological and that could be, more on the emotional trauma side of things.
Yeah, you were mentioning that you would eat like large volumes, or you would feel like you like that would hit the spot. Volume addiction is a very, very real thing. It also can be an addiction, a behavioral addiction in a way where you get those dopamine hits, and some people can exercise that addiction with lettuce. That's in the form of anorexia. And some people can get those stretch receptors to be triggered and to release that dopamine just on meat. So it is totally, totally something that can stay alive, and your addiction stays alive instead of truly getting to the root cause, healing the gut, healing the addiction. Why is it that you feel that you need to get the dopamine from that way as opposed to other ways? You know, there's so much that goes into it.
Yeah, no, 100%. And I don't know. I'm going to ask you how you feel about this because I kind of see like this is my own experience and what I see with some clients.
Yeah.
So obviously there's the individuals who have the background of sugar addiction, food addiction, trauma that's driving all of that. And that obviously, needs to be dealt with from a surface, level with the foods they're choosing and then whatever's underneath the surface. And then the other piece of the puzzle, or the other side, I should say, that I've kind of experienced, and this is more of like my background personally, and then I see this with clients, is there might not necessarily be a trauma per se, but it's more of a physiological imbalance. Like for me,
Yeah.
years ago, it was my hormones, it was my poor gut health, it was, yo-yoing in the week, trying to eat 1,200 calories and be perfect with, exercise and do some cardio. And then on the weekends, I just got to the point where I'm going to go out to eat because I can't, maintain this through the weekend. So there was not really a, you know, food addiction,
Yeah.
eating disorder kind of thing, but there was those physiological imbalances that drove the cravings. And as soon as I eliminated those imbalances, I was able to take control of my food. I was able to make better choices. And then they just sort of domino affected in a good way off of each other, which again, that's, let's call it one type of client that I work with. And then there's the other side of the spectrum where they do all that, but there's still something else driving whatever their reason is to turn to whatever the substance is, whether it's sugar, whether it's food, other things, etc.
Yeah, yeah, you don't necessarily have to have a trauma, an early childhood trauma, or at any point in time trauma for somebody to develop. It starts with a habit that then and then it turns into an addiction. It gets wired in more strongly in the brain, and now we have a full-blown addiction. And then you have stages of addiction, and if you reach end stage addiction, you know, we have to know also which stage you're at. So totally, there's people just because they've just eaten a lot of sugar because of the environment. They celebrate with sugar. When they go out with everybody, they eat sugar. Like there's no real psychological driver, right? It's just a
Right.
lot of exposure or just a habit. It's the habits start so small, you don't even catch that you're doing it until it becomes a problem, right? Or, you know, they just have gluten insensitivity or dairy sensitivity that's messed up their gut, and all their life they've been dealing with poor mood or cravings for sugar as a way to make themselves feel better, give themselves some energy because the food sensitivity caused poor nutrient absorption and caused them to just not feel well, so they realize they can get some quick energy source from certain foods. So yeah, there's totally that. And then here's the thing, they do sometimes also mesh, because if you're chronically ill and you develop some form of unhealthy eating habits, or let's call it addiction,
Mhm.
it's gonna affect other aspects of your life sometimes, right? It's gonna affect your productivity, your income. It's gonna affect your relationships. It's gonna affect how much strength you feel to set boundaries and to have healthier communication. And then the people who have underlying trauma and they've learned to cope with those feelings with food, eventually just eating that way is going to lead to gut issues as well. So there's a lot of overlap, but yeah, the how it started, it can be different. For me, for example, um, it just started, I think I was 11 or 12 and I decided that I needed to lose a couple pounds. The dieting, but the crash dieting, because I didn't understand how to diet, right? It was like the restrict and then binge on a Nutella jar. So you do that enough times, enough cycles, yeah,
Um,
you're going to develop all kinds of gut issues, which are going to now increase your sugar addiction levels. And if you don't understand what's going on for a long period of time, then you get to a stage where it's a severe food addiction problem that's affecting every area of your life.
yeah,
So,
no, I think it's definitely, connected in various ways.
yeah, yeah, it's really fascinating stuff. It's just sad that it takes so long to put the pieces together. I just wish I wish I never even like attempted to diet from a young age, or just like we ate meat, and like the whole trajectory of your life would have been different. You would have chosen different career paths, different all kinds of stuff, instead of everything revolving about food, how to recover from the food, and even the careers that you choose are affected by how you feel about yourself, how you feel in your own skin, you know? Yeah,
Yeah, no, I mean, I definitely agree. I agree with all of that. And I think that, I think it just comes back to becoming passionate about certain things. And the more we learn and the continuing education aspect and, everything is interconnected.
everything. It truly is. I think the income thing, I don't think people put enough um, awareness around how much your income is affected with addictions, because as part of what I do, I also study a lot of addiction content, not just with food addiction, all kinds of addiction content on all kinds of drugs. And you see it more pronounced, with
Yeah.
cocaine and alcoholism, and people can't keep a job, or they go broke, or they have so much debt, and they realize how much their income is affected by their addiction. And I don't think people who are food addicts realize also how much their income is affected by that, because I remember when I would go on binges, like the whole day is shot, like zero productivity. There's like this carb coma that
Right.
you have no motivation, even if, and here's what happens, something called moral licensing. You tell yourself, I'm gonna have a little bit of sugar to give me some energy so that then after I have this meal, this binge, then I have all the afternoon and I'll work and I'll be so productive. And that never happens after you eat those foods. And then it goes like, oh, we already ate. Let's just watch a movie, and then it's been 2 hours. Let's order some more stuff because
I was
who
going to
cares?
say have something else.
Exactly. 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 Like a complete, physical relapse. So, yeah, being aware that this is a real addiction is step number one. And people hate to hear that word. And I have to be so creative in my content to avoid using the word addiction, right? Because people freak out if everybody's in denial. I mean, I was in denial for decades. So.
Yeah, no, and I think that the hardest piece is that part. And like we were talking about earlier with the nervous system regulation. So the clients that I tell them, I can give you the perfect macros, the perfect, we can get your labs, the most brilliant supplement protocol, all the things. But if there's still nervous system dysregulation happening and other things under the surface, what I do, it might work a little bit, but it's not going to work long term. Or, you're just going to get to a point where you're going to feel like you're pushing your head against the wall again. So if you're someone who has tried everything, and I am the last stop so to speak, that many women make because they just have maybe honestly been to a functional doctor and they only looked at half of the puzzle instead of the whole puzzle. I have that happen a lot.
Yeah.
But again, there's this little percentage of like, you got to work, you got to do the nervous system regulation stuff. As soon as you do that, and your body is used to reacting in a certain pattern, and it's been reacting in this pattern for years and years and years, you have to break that pattern. And no macro formula, as much as it's personalized and customized and perfect, is going to break that pattern. And so, as long as you combine all of these different sides of the spectrum, that's what's going to give someone the best long-term results.
Yes, and but that's the hardest part because that's where the discomfort, right? That's
Yeah.
where they actually have to sit through the discomfort
Yes.
and change. And yes, people try always to do everything that can minimize discomfort, which is fine, it's just that for me, after trying to find the hack and the shortcut and try to find the easy way all my life, I realized there is no easy way. The only way out is through, right? So now, like, I used to buy all the supplements in the world, right? And like, you would open cupboards and cupboards, every single, nothing is gonna work if you're not prepared to also do all the things that you have to do along with it. And that comes with a feeling of discomfort. So now the question is, when is a person ready to change, right? They have to be ready. The level of pain in their life has to be so great that the little bit of discomfort that, by the way, it's just initial discomfort. Like you change your diet, you're only going to suffer a little bit in the initial phase and then you adapt to everything, right? So when I say discomfort, just keep in mind, like you're not going to be there forever. It's just to adapt to this new way of living. And so people either have to have so much pain that say they're about to cut off their colon because Crohn's disease has progressed so much that, that's where they're at to make the change, right? Or what I would recommend, don't wait because that might happen in 10 years or in 20 years, why wait? Instead, I prefer to gently push my clients to be driven by their pull forces, right? Be inspired, set big goals, stop with the limiting beliefs. There's nothing you cannot accomplish. And that's what keeps people stuck because everybody has a big dream. Everybody wants to make it big, but they have accumulated so many limiting beliefs that they never challenged. They never went on a podcast or learned about that topic so that they learn how to break that limiting belief to understand like no, it's actually very realistic that you can break that limiting belief because look at all of the developments that are happening, the progress that we're making in humanity. So if you don't actively destroy those limiting beliefs, they're going to accumulate and accumulate and accumulate to the point where you feel like even me saying the word a big dream, they're probably rolling their eyes. It's like, and so
So I have a couple things on this. So first of all, this is funny because not funny, haha, coincidence, of course, but there are no coincidences, right? So my online 7-week weight loss accelerator program, I just started with a new group of ladies on Sunday, and I talk about baseline versus stretch goals. And prior to talking about their baseline versus stretch goals, I talk about what's at stake for them. And I have never resonated with the question, what's your why? We hear that all the time in this space. What's your why? Your why isn't big enough. That is something that I'm like, never, ever did that resonate with me. I'm like, what's my why? Like, what does that mean? So I have shifted that over the years. And like I said in the program, I asked the ladies, what's at stake for you? Like, what is truly at stake for you to make these changes for you to get the goals? Because if you don't have something big enough that's at stake, it doesn't matter. It doesn't matter. It's not, this is going to be no different than anything else you've done. So then from there, I have them look at baseline. So baseline is something that's achievable. It's a goal and it's a challenge, but it's achievable. And then they have stretch goals where it's achievable, but it's a stretch for them to do it. And they need to, maybe on a busy week, they might hem and haw about it a little bit, but it's a very good way to sort of look at, okay, baseline, I know I can do this. This is still a goal. It's okay to have a baseline goal. And then the stretch goal. How am I going to stretch myself a little bit further to get to that next level to overcome my limiting beliefs that I've been talking to myself about for 20 years and telling myself the same old freaking story, so that we can shift that. And with that being said, back to the limiting beliefs that you were talking about, is I love that we as women, especially, and men too, I'm sure you have men that might watch this. But we also can reprogram our cells, our thoughts, and everything in between. So I always say the body hears everything the mind says, even if it's subconscious. So
Mm,
if you go to sleep, if you're struggling with autoimmune issues and your doctor's not giving you answers and you've been trying to lose weight for a long time and it's a stressor because you don't know how, and you go to bed every night subconsciously or consciously thinking to yourself, I have autoimmune. I don't know how to fix it. How am I going to fix my thyroid medication? This doctor won't do this. I can't lose weight. I mean, the list goes on. You're going to program that into your body and into your cells when you sleep at night.
yeah.
Or you can start to look at what's at stake and create a gratitude list. Simple as that. It could be a bullet point list, or it can be changing, becoming aware of all of these negative thoughts and then shifting them to I am powerful. I can lose weight. I am comfortable in my skin. I am. Affirmations, intentions, even if you don't believe it at first.
Hmm.
Even if someone doesn't believe it at first, and you just continuously tell yourself, eventually that reprogramming is going to happen and the shifts are going to start happening.
So well said. Reprogramming, exactly. The brain wires itself. Every thought you repeat creates thicker connections between the brain cells that relate to that thought and more myelination, that fatty tissue that cements that connection between those brain cells. So every thought that you repeat, you're literally creating thicker and thicker and thicker brain pathways where your brain just naturally wants to repeat them on automatic. And if you try to change them, the more you repeat them, when you try to change them, the more discomfort you're going to feel, the more pain you're going to feel to try and change it. So why bring upon yourself more discomfort in the future when you're trying to change them? Just don't repeat them and substitute them with better thoughts. Yes, yes, yes. I love it.
Love it.
Yeah, I mean, mindset is like everything to me. I could talk for hours and hours and hours on that. I feel like if anybody comes in, no matter how difficult they might tell me how hard it is for them to change, no matter the reason, if you tell them that if you do this, let's say just do carnivore, strict carnivore, push through the uncomfortable moments to create and at the end of a week of carnivore, at the end of 30 days, whatever, I will give you $1 billion. Everybody will do it. All of a sudden, oh, I have POTS, I have autoimmune, they forget about it in a split second because there was a good enough reason, right? Pull forces or stretch goal, right?
What's at stake?
Exactly. All of a sudden, so now you know that you always were able to do it. It's just you didn't really think it was worth it because you didn't attach it to something worth pursuing. So,
100.
yeah. Okay. I love that. We did mention, well, you shared something that I really want you to tell everybody about with the fasted insulin and the weight loss. Can you share a little bit what you're telling me about? Yeah.
Yeah, absolutely. So it is very common that we hear all about fasting insulin and test your fasting insulin, and it's a big blocking factor. So when I say blocking factor, I'm referring to something that is blocking us from getting our results, whether that's weight loss, fat loss, more energy, whatever the result is, blocking factor blocks us from that. So having elevated insulin obviously is a problem for, metabolic inflammation, for metabolic health for many reasons. And it is also said that science says that someone cannot have a perfect optimal fasting insulin, be low carb, and still have a weight loss stall. And I see this on, I tell you, a weekly basis with countless women in my practice where we run their comprehensive blood work, like we talked about, and their fasting insulin is perfect. So optimal. So lab range is 2 to 22. Optimal for me that I look for is 4 to 6, very tight range. And I cannot tell you how many women that cannot lose weight, cannot drop fat, they're stalled, whatever term you want to use, their insulin is perfect.
Hmm.
And so I say, and maybe their glucose is perfect, but maybe their glucose is elevated. There are so many different patterns that I see with a perfect insulin that still relate to why their weight can be stalled or why they're not losing, that we put so much, and it's not that it's not important. So I'll just say there's so much energy put into insulin, and it is 100% important. Don't get me wrong. I just want to like say that a million times just to be super clear. However, like I said, I see this countless times on a weekly basis where women have perfect fasting insulin and they still are stalled, and there's other things going on that are either related to glucose or leptin or inflammatory markers or gut or detox, sluggish liver, whatever the things are that are also at play with their weight loss and fat loss stalls.
Yeah. Agreed. I have clients right now, same thing, perfect fasted blood sugars, perfect fasted fasting insulin. That's not the only measure, and I feel like sometimes some content out there kind of just focuses so much on that, and the experts will say that's another thing. I really, really want to remind everybody, always try to take advice from somebody who's been in a similar situation as yours and overcame that. If I just had somebody tell me this advice when I was young, I would have saved myself so much time, because I probably wouldn't even have gone to school for a bachelor's and then a master's and then like decades in traditional academia all the way through to the PhD level from people who never had that transformation. So they're just reading off the book, right? And it's just teaching us all the wrong things. It's insane. So just because somebody has a PhD or an MD, or just because somebody went to school and passed a few tests, does not mean they're giving you the right answer. If that person doesn't also have that personal experience that's very similar historically to yours, I think that is where you can get the closest to what potentially could work for you, right?
Yeah, and I think so the personal experience, 100%. I am a huge believer in walking my talk. And when I was years ago, when I first started down my own path, if someone, go to someone who has what you want, go to someone who's been down that path. I was very picky and choosy and I'm still picky and choosy with who I, look up to as a mentor and who I follow and all that stuff. And so that, also what I was about to say too is like the clinical aspect. So science and studies and, you know, that's all great. It's good information. But we need to also take all of that and see how does this play out in clinical practice on a daily basis with hundreds and thousands of women over decades of, doing this on repeat and on repeat. And what do I see, taking that information? Okay, this is what the study says, but what actually happens clinically when working with someone, and how does someone respond? And, what do we see as all the factors and all of that kind of thing.
Yeah. You can pull up a study to support anything, any
Exactly.
wild thing you want to say. That I bet you there's a study. There's even a meta-analysis, a pooling of all the studies that will show exactly what you wanted to say. So how do you know, there's so much contrasting information. How do you know what to go with, Because if we just look at the nutrition evidence right now, the nutrition studies, the vast majority of the nutrition literature is backed and funded by the food industry, because that's the source that has the most amount of money to fund nutrition studies. And so they're all pretty much epidemiological. They're all pushing plants and, eat more plants and that kind of narrative. And so if I'm just going to follow somebody because they have an MD or a PhD or some form of like academic credential, because they've studied that kind of evidence, those studies are what they learn, you're going down a very, very dark path. Yeah. Yeah, that's what happened to me. I went and I saw a dietitian at 14 to try and help me lose weight. It made things worse because she was educated on the food guide pyramid, and that's what she told us to do. And so now my mom started adding even more carbs to our meals. We never used to eat so much pasta and rice before we went to that dietitian as compared to afterwards, which made the whole binge eating disorder worse, gained even more weight. I mean, yeah, so you got to be so careful where you're getting your information from. This is why real life practice, yes, and experience, like you mentioned, that's where I would go as opposed to just, oh, doctor says that they must be true. They must know. So, anyway, that was fantastic. I wish we had tons more time to talk about all these things in more detail. But we'll keep it for round three. Is there anything that you would like to tell everybody, leave them with a happy note at the end?
I think, one size never fits all. It doesn't mean everything out there is all wrong. It means you just need to figure out what's right for your body, your metabolism, and what's going on in your stage of life at the moment. And I also like to say, whatever stage of life you're at, especially if you're, a woman over 40, um, you're not, um, forced to be what society says that should be happening at that age, and you can have your goals at any age. I have clients that are 40, 50, 60, 70, and they're losing weight, they're gaining muscle, and all the things in between. So that's what I would leave everyone with.
Yep, yep. 60 is the new 30. That's my motto, right? Look at Demi Moore. Sure, we might need a little bit of, tweaks here and there, but get to work. Let's get a side hustle and let's make the 60 the new 30. I mean, yeah, and just the sheer amount of progress that's happening, the sheer amount of treatments that are available to everybody, as we get older now, we don't have to age the way the older generations used to. We don't have to feel this loss in vitality that the old generation was. We have so much more education, so much more awareness, so much more tools at our disposal. We just
I
have to
was
decide that we want it.
Yeah, I was gonna say there's so many more innovative things. Like I said, I use so many more innovative approaches and strategies now with clients than I had available in, 2010 and, years ago. So there really is something for everyone, and it should just, again, individual biochemical individuality is really key, and that's how it should always be approached.
Yep, yep, perfect. And how can people sign up to your it's a 7 week weight loss challenge? Is that, yeah?
Yeah, so I have a few different things going on. So my weight loss accelerator program. So it's not a challenge because I hate the word challenge.
Oh,
It's okay. It's a program, so it's 7 weeks. We have a curriculum. I build on each topic builds on the topic before on a weekly basis. It's in a private community off of social media. And so that's the Weight Loss Accelerator. I also have the Wellness Collective, which is just a monthly community where I do just weekly deep dives on Zoom. So it's not a curriculum or a program. I cover hormones and peptides and gut health and just different topics that I want to deep dive into or that women have asked me about. They've heard this or they've heard that, and I want to give them the true science behind it. Like one really successful one was the connection with adrenal health and thyroid health, because everyone is so focused on thyroid and no one's really talking about how much the adrenals play a role. So that's the kind of stuff that I do in the Wellness Collective. And then, of course, I have my one-on-one practice, and my website is nutritionthenaturalway.com, and lots of information there. And of course, on Instagram, I spend time in my stories. I like to do Q&A, carnivore.keto.fitness.
perfect. I will make sure I list the links in the description box of this YouTube video so people can find you very easily and connect with you. Thank you so much, Dani, for your time and your wisdom.
Thank you, Dr. Sir, for having me. It was so great. Next time we'll do it again.
Absolutely, we have to. Thank you, everybody, for sticking with us till the end. If you enjoy this kind of content, make sure you give this YouTube video a thumbs up, subscribe, and hit that little notification bell icon so YouTube alerts you every time I post a new video. Thank you for watching, and I will see you in the next one.